I'm a doctorally prepared oncology nurse, and I administered these drugs myself for about 13 years before earning my PhD. And now my program of research really centers on understanding and minimizing occupational and environmental exposure to these exact carcinogens that we're talking about administering today. But the majority of my program of research really focuses on the types of healthcare workers that Caroline was talking about, the nursing assistants, the environmental services workers, the health unit coordinators, who don't get the same standardized education and training that we as nurses and our friends pharmacists get annually. I wanted to let you all know about a couple of updates in the way that we are recommending safe handling be done. So as Caroline mentioned, I'm the editor of this book that we love, which is the Oncology Nursing Society Safe Handling of Hazardous Drugs, and my co-editor, Michaela Olson, is at Johns Hopkins, scrubbed all of the evidence, and we no longer recommend flushing toilets twice each time that they are used. And I want to tell you why that is. First of all, the toilets that are in hospitals are very high pressure. So double flushing has actually been shown to increase the number of aerosolized particles, which increases the amount of anti-neoplastic drug contamination in the bathroom. And so I wanted to share with you a couple of things that we learned from a study that we did with nursing assistants. And we collected this data back in 2017, 2018. And here are a few of the top line results from that study. First, we all know, and Caroline showed you on the screen, what the required PPE is for handling body fluids. And it includes 2 pairs of gloves that have been tested for use with anti-neoplastic drugs, a disposable gown, and a face shield if splashing is possible. In this study, we recruited 27 nursing assistants, and we observed them doing their routine work tasks and then talked to them about how they protect themselves. And what we learned is that they way over-reported their PPE use compared to what we observed. They used single gloves. They used no gowns. We only observed the use of a contact isolation gown once, and no face masks. Also, you saw Caroline write that hand sanitizer gel is ineffective, and 50% of the time the nursing assistants washed with soap and water. The other 50% of the time they washed after they doffed their gloves with hand sanitizer. And so there was lots of room for improvement when it came to proper PPE use, the recommended PPE use, and also proper hand washing. We also learned by watching them that they used some antiquated practices. Some of these included double flushing. We were still seeing double flushing in practice. And then a really old technique that I was trained by over 20 years ago, which was called the flush and rush, where you literally hold your breath, flush the toilet, and run out of the room. And so we were still seeing NAs do that. What they told us is they follow nurses. Because they don't have standardized education and training, they do what the nurses on their unit do. And it's part of the reason why nursing is so critical. So nursing is modeling behaviors for nursing assistants, but also nurses very frequently are put in positions to give education and training to nursing assistants. And so it's really important that we're doing the right things.